The UK lockdown saw all dental practices temporarily close their doors and suspend all dental activity. And the alarming consequence of this was many people having to resort to undertaking DIY dentistry in their own homes. In fact, the Google search term tooth repair kits saw a 750% increase during the lockdown. What we thought we'd do is basically to put some sensible advice together on why you should avoid DIY dentistry and what to do if you do need to contact your dentist. Taking out a tooth can be incredibly difficult and something a dentist would learn to do over many years of training and experience. To attempt this in a DIY fashion is incredibly difficult. One is the logistics of trying to actually remove your own tooth means this is going to take a very long period of time. Secondly, because of the difficulty, it's likely that there would be a root fracture, which in itself then causes further problems and difficulties. The instruments used are probably not going to be sterile, so there's a high risk of wound infection and wound swelling afterwards. And thirdly, without the appropriate aftercare, there's also a risk of uncontrolled bleeding. Since the 8th of June, most dental practices in England have reopened, with most teams such as ourselves showing increased safety measures such as advanced PPE, temperature checks and enhanced cross-infection. However, as a result of the social distancing measures and the backlog of appointments, it means that patients are still waiting longer than normal to be seen. If you do have any urgent inquiries, I would always recommend reaching out to your dental practice and so they can offer advice and guidance over the phone, and they can triage those patients that are truly urgent and get them in if they need to be seen. For our practice, we would ask you to reach out through our usual social media channels and our email address is info@blossomdentalcare.co.uk, and we look forward to helping you in any way possible.